Today, we're going to break down a really big change in U.S. visa policy. It's a brand new hurdle for people who want to come to the United States, and it's all about something you might not expect, their health. So let's get right into it.
Think about that for a second. Could your health actually prevent you from getting a U.S. visa? You know, until pretty recently, the answer for most people would have been a clear no, unless, you had some kind of serious contagious disease. But that's all changed. For a whole lot of people, this has become a very, very real question.
So here's the bottom line. New instructions sent out to U.S. embassies all over the world now give consular officers the green light to deny visas based on pre-existing chronic health issues. And we're not talking about rare diseases here. We're talking about things a lot of people live with, like diabetes, heart disease, even some cancers. Okay, so you're probably asking why? Why the sudden change? Well, the answer is all about a new and much, much stricter take on a very old immigration rule. It's called the public charge rule. Now, this rule itself isn't new, not at all. It's been part of U.S. immigration law for over 100 years. Its original goal was pretty straightforward, to screen out people who were likely to become financially dependent on the government. And this is where we see a huge shift. I mean, a complete 180. For decades, the health screening for a visa was all about public safety, right? It was about stopping the spread of things like tuberculosis. But the new focus, it's totally different. It's all about economics. It's targeting those chronic, long-term conditions that could be expensive to treat over a lifetime. This, of course, leads to the next big question. What specific health conditions are visa officers now looking for? And wow, the list from the State Department it's pretty extensive. It's got cardiovascular and respiratory diseases, cancers, diabetes, even mental health conditions. And to give you an idea of just how broad this is, the guidance tells officers to look at obesity, not just by itself, but for its potential to cause other expensive problems like asthma, sleep apnea, and high blood pressure. So just having one of these conditions isn't an automatic denial. But, and this is a huge but, it triggers this new, incredibly difficult financial evaluation. We're calling it the lifetime cost test. This quote right here, this says it all. It comes straight from the State Department's cable to its embassies. It tells officers to flag anyone with a medical condition that could possibly need hundreds of thousands of dollars worth of care. I mean, that phrase really shows you the scale of the financial concern that's driving this entire policy. So what does this mean for the person applying? Well, the burden of proof is just immense. If you have a condition that gets flagged, you now have to prove that you have the money to pay for all potential medical care for that condition. And not just for a year or two, but for your entire expected lifespan. All without ever touching public assistance. It's a massive hurdle. With a rule this broad, it's really important to ask, who's going to feel the impact the most? What we're seeing is that while the guidance is pretty wide-ranging, it's really aimed at people who are trying to immigrate to the U.S. for good. So that means if you're applying for a green card or another immigrant visa, you're going to face the most intense scrutiny under this new health-based financial test. So think of it this way. For immigrant visas, people coming to live here permanently, this health check is now a huge part of the process. But what about non-immigrant visas, for tourists or students? Well, the rule technically still applies to them, but it's probably not going to be a major focus because those folks already have to prove they can pay for their short trip anyway. And really, this all boils down to one big fundamental question. By tying someone's long-term health forecast to their ability to immigrate right now, this policy creates this whole new connection between health, wealth, and the right to move. It's a really complex issue and definitely something we're thinking about.